to our live Q&A today and help a lot of people out there that have questions about navigating the bureaucracy, survivor benefits, spouse benefits, disability benefits, Medicare, Medicaid. Let's talk about some myths. So I've gone over 5 different myths. And as usual, I try to give out as much information as I humanly can. So rather than talk about one little detail miss, I'm going to break it into big categories so we get as much information out there as possible, because too many people aren't getting the benefits they're eligible for, they need, they're entitled to, and all the rest of it. So the 5 myths actually are probably going to turn into about 10 or 15 or 20, but it's a beautiful thing. All right, so number 1 myth for Social Security is about working. People think they cannot work once they start receiving Social Security benefits. And so we'll talk about retirement benefits and disability benefits. You can work while receiving those benefits. In terms of retirement benefits, then you can once you hit your full retirement age, you can make $1 billion a month, and it doesn't affect your Social Security benefits negatively at all. It might actually increase your benefit amount. Your benefit amount is based on your high 35 years of earnings. So if that $1 billion is one of your high 35 years, then guess what? It's going to increase your benefit amount. Okay, if you're under your full retirement age, then yes, there is a limitation. This year it's $23,400. Anything over that, Social Security holds back $1 for every $2 you go over. The year you turn your full retirement age, those months before you turn your full retirement age, the limit is about $62,160, and that changes every year. We don't know what the numbers are going to be for 2026. Once they come out with those official numbers, I'll make a video and I'll go over all the numbers for working and disability and Medicare and SGA and all the rest of it. So make sure you subscribe and like, and that way you're kept abreast of all the changes with Social Security. And we're in the middle of a shutdown too, so we're going to talk about that. I'm going to give you some inside tricks tomorrow on shutdown with Social Security. It's a little bit different this time. I just got some internal word from Social Security that they're changing some stuff. This is different than any other shutdown, but we'll talk about that tomorrow. I doubt within the next 24 hours Congress is going to do anything, so if they do, then I'll talk about something else. But anyway, what about disability benefits? Disability benefits, 100%. You can work and collect disability benefits. It's far more complicated on my website, mygovexpert.com, or you can go to ssa.gov, and a little bit more difficult information to understand under ssa.gov, but you can use my website as well. You click under disability there, and it gives you all the details about working and benefits. I've got a free guide there, a calculator, and it talks about trial work period and all the rest of it. A lot of people call Social Security and say, hey, my neighbor, my cousin, that lady down the street is working, collecting disability benefits. It's a fraud, yada, yada, yada. No, if you're on disability, you are allowed to work. There's a bunch of limitations. You know, Congress and we as a people decided, yeah, if you're on disability, we want to see if you can go back to work. So we're going to allow you some, incentives to go back to work to see if you're able to go back to work. Because if you can, then you're going to make a lot more money, and you'll get off the Social Security Disability Trust Fund. And so it works out for everybody. So that's why Social Security, Congress has decided that to have all these incentives. A lot of people don't understand them and get in trouble. So as long as you do everything right, more power to you. All right, so another thing about disability, let's go on to number 2, disability. And there's, in terms of working in Social Security, there's a whole bunch of other regulations and limitations and exclusions and all the rest of it. I've done a bunch of videos for that. If you've got any specific questions, that's why I do a live Q&A, which I should start here in about 10 minutes. All right, disability benefits. Probably the biggest myth about Social Security disability benefits is that everybody is denied the first time. And this is a myth that just has to stop. It's 100% incorrect. A lot of people deny the first time? Yeah. Are a lot of people approved the first time? Yeah. Got a lot of people here that were filed for benefits and were approved the first time. Some people were approved the same day, so it's the same week, the same month. Unfortunately, those people usually have terrible, terrible disabilities, and that's why they're approved so quickly. So I guess it's kind of a bittersweet thing. It's like, oh, great that the Social Security Administration, treated you well and approved your disability immediately. But the reason you were approved in 1 day or 2 days is because you have unfortunately, a terrible disability. So that's kind of a bittersweet type thing. For other cases, the general type of disability cases, unable to work, right now it's taken 6 to 9 months to get approved, unfortunately. And then if you're denied, then you have appeal rights. But there's people out there, wants to be negative about everything, and they say, oh yeah, Social Security denies everybody the first time. No, that is 100% incorrect. I've taken hundreds of thousands of disability claims myself when I worked at Social Security, and a bunch of those were approved the first time. Some, I'm like, wow, I'm not a medical doctor, but I'm like, wow, I think that one should have been approved. Not sure why they denied that one. And other ones, it's like, wow, not sure why that one was approved. Should have been denied. But again, I don't get all the medical records. That is sent up to a medical agency in your particular state that makes that decision. So those people out there that are repeating that myth about everybody being denied the first time, please stop it. You've got people out there that are disabled, unable to work. They've got financial issues. They've got either disability issues. They've got a whole bunch of other issues, and they don't need negative people around them to say, oh, you're just going to be denied the first time. Stop it. Let them apply, and don't wait for your documents. Here's another myth. Oh, well, let me get all my medical records all set up before I apply. No, apply. You don't need to provide your medical records to apply for disability. You apply, and then the Social Security Administration gets all those records for you directly from the sources. If you want to provide some, more power to you. I've talked about that before, whether it's good or bad, but apply. Start the process, because the process takes so long. Start the process. Don't wait. If you want to use a lawyer for the first couple of stages, you can do most of the stuff yourself. It's relatively easy. You just answer the questions, but if you want to use a lawyer, more power to you. I guess that's also another myth, is that you get a higher approval rate if you use a lawyer. Well, lawyers are also, I hate to say bad things about lawyers, but they're also selective. So if you got 10 people calling them up and say, hey, will you accept my disability case? They will ask all those 10 people, well, what's your disability? Oh, that doesn't sound like it's going to be approved. So no, I don't want your case. And then, so they take the 4 or 5 cases they think they're going to get approved, because they don't get paid until they get approved. And so, yeah, they have a higher approval rate because they're selective in their cases. So, yeah, sorry to tell the reality about using a lawyer. But if you want to use a lawyer, more power to you. Always use a local lawyer that knows the local judges, and so someone that you know and trust. All right, what about number 3, the biggest myths on spouse and survivor benefits? There are tons of myths about spouse and survivor benefits, but let me just throw out a few. So spouse benefits. If you were married multiple times, you can get benefits on any of your ex-spouses as long as you were married to that person for at least 10 years. We're talking about just a living spouse type of case. So if you were married to 3 people for 10 years each, Social Security will look at each one of those records and determine which benefit is the highest amount. Okay. Another myth is that it will affect that person's benefit. No, it will not affect that person's benefit. So if your previous spouse got remarried and has a new family and whatever, no, won't affect their benefits 1 penny. Not at all. They won't even know about it unless you tell them. Another myth is that your previous spouse has to be receiving Social Security benefits. That is incorrect. It's called independently entitled divorce spouse benefits. If your ex-spouse you were married to for 10 years, as long as they're 62 years old, you can get benefits on their record, regardless if they file for benefits at all. It's called independently entitled divorce spouse. Okay. All right, and another myth is the divorce decree. Well, in my divorce decree, I signed that I won't get their Social Security. Yeah, Social Security doesn't care about what you signed. That is your eligibility. You're entitled to those benefits. If you were married to that person for 10 years, you're entitled to those benefits. Your benefit amount has to be less than half of that person's benefit amount, but you are eligible for that person's benefit regardless of what it says in the divorce decree. Okay. Survivor benefits. The myth on that one, the big one, is that you, excuse me one second here. Seasonal allergies here. Okay. So survivor benefits. Survivor benefits, you don't get those two checks. You don't get two full checks. When your spouse passes or your divorced spouse passes away that you're eligible for survivor benefits from, you will not get two full checks. Your benefit amount, if you're receiving benefits on your own record, will offset what you receive from that full benefit amount. So let's say you're married to someone and you've got $3,000 coming into the house. You get $1,000 and that person gets $2,000, $3,000. Person passes away, the higher earning spouse passes away. The next month, you're only going to get $2,000 in the house. Basically, because you always hear, well, when your spouse passes away, you get that check. Yes, you do, minus your own. So you'll continue to get your $1,000 and that $2,000, but your $1,000 will offset that. So you'll get one month, $3,000, next month, $2,000. So I've had to break the news to people way too many times, and they were anticipating having both checks, both full checks. And unfortunately, yeah, a lot of people get hurt and struggling and have a very, very difficult time after they've lost a loved one. So let's make sure we get that information out there. Okay. What about Medicare? Tons of myths about Medicare. Are you mandated to sign up for Medicare when you turn 65? Yes and no. If you don't have creditable coverage, that is health insurance from current work, yours or your spouse's, and that employer doesn't have 20 or more employees, then you have to sign up for Medicare. So if you have health insurance from your work, let me repeat this. You have currently, let's say you turn 65 and you're like, should I sign up for Medicare? If you have health insurance, do you have health insurance from yours or your spouse's work? Does that employer have 20 or more employees? If yes, then you don't have to sign up for Medicare. You can delay it 5 years, 10 years, 20 years down the line. Once you stop receiving that that health insurance from current work, then you can sign up for Medicare at that time and save yourself the $185 a month for the next, years until you stop working. You do have to sign up for Part A once you start receiving Social Security benefits. If you receive Social Security benefits and you turn 65, then yeah, A is mandatory. There's exceptions if you have to pay for A. There's very, very, very small percentage of people that pay for Part A, the monthly premium. Everybody else is zero. So if yours is zero, like 99.9% of people out there, then you have to start Part A when you turn 65 years old. Part B, that's the one you can say, yeah, forget about it. Part D, the prescription drug plan, same thing. Forget about it. I've got creditable coverage, my or my spouse's work, 20 more employees, and all the rest of it. So, and then the only thing you have to do is once, let me pull it up here. Once you turn, or once you lose your health insurance from work, then you're in what's called a special enrollment period. So once you lose health insurance from current work, then you have 8 months to go ahead and sign up for Part B, and you won't be penalized at all. You just need a couple of forms. This one right here, the 40B and the 564 there. I've got links there. You can download them or get them from the SSA website, and you just go ahead and submit them, and there's no penalty whatsoever. So you technically legally have 8 months, but you know what happens when you don't have health insurance for 8 months? That's when you actually get sick or fall or whatever the case may be. So about a month or two, if you're going to be losing your health insurance from work, start the process. And here is one of the difficult things right now. I'll talk about this again tomorrow when I talk about the shutdown, if it still continues tomorrow, which I think it will. I think this is going to be one of the longest. I think the longest one in U.S. history was during the last Trump administration. I think this one is going to, yeah, it's all about health care. Whether people can get health care has nothing to do with immigrants, illegal immigrants. So it's all about the Affordable Care Act, millions of people being kicked off that, millions of people losing their Medicaid, and even people eligible to receive Medicaid because states are cutting back. It's unfortunate. But if You are going to be losing your health insurance from work in 2 or 3 months. You've got plenty of time, no problem. But if you all of a sudden lose your job and you lose your health insurance from work, it's important, especially during the shutdown, that you take action immediately. And don't fax your forms in, those 2 forms I sent you. I told you about. Don't call and schedule an appointment. Take those forms, get them filled out, take them down to the local Social Security office and tell the person, the Social Security employee, to do it, to push that button. I just got information today on exactly what they can and can't do at the local Social Security office. Kind of an internal information there that is different than any other previous shutdown. So this one is going to be a very, very strange one, but I'll talk about the details on that tomorrow. So you have to make sure you get it started, and that way you're not without health insurance. And then you just have to make your decisions on how you want to fill in the other gaps, whether you want to do a Medicare Advantage plan or a Medicare Supplement plan, what you're going to do with your Part D and all that kind of stuff. If you need help, Chapter can help you out. And if you need help with the AEP, which starts October 15th. You can actually start reviewing your plan right now. Call your, whoever helped you out with your Medicare plan, call them up and say, hey, well, how's my plan look for 2026? Does it look like is there a better plan out there? And if they find a better plan for you, then they can start signing you up, switching your plan from October 15th to December 7th. So you have that time. So make sure you're prepared. You have your current plan, so you compare, which plans they're the best. Your providers, your physicians, your clinic that you have to go to, the hospital that you like, your prescriptions, what your prescriptions are, the dosage, the names. Can you take a generic? What pharmacy you want to use? What's your priorities? Do you need more dental? Do you need to save money on hospitalization? Do you need vision? And have a little patience. You don't have to, the plans aren't going to run out on October 15th. So between October 15th and December 7th, you have that opportunity. But definitely don't wait till that last week. It's going to be crazy. So you can call Chapter and they can help you out, save you a bunch of money. And they also help people out throughout the year. So if you ever have a billing issue or you need to find a new doctor, you call Chapter and they help you out. So, and they support this channel and all our live Q&A and our website and all the rest of it. So. All right. What about the myth about the future of Social Security? Well, Social Security, as long as it's not privatized, it will be around here forever and ever and ever. But the issue is, how much are you going to get? As of right now, so I just changed this. Last month, it was only 88 checks. Now it's 87. So there's 87. You're going to receive 87 more checks, like your check is right now, your full check. And then the 88th check is going to be cut by 23%. Why? Because the Social Security Trust Fund is running out. It wasn't stolen or, it's, all that misdirection that politicians try to use to, it's fraud, waste, and abuse, or it's illegal immigrants. Those are the tricks that politicians use, and we keep buying it. And it's fraud, waste, and abuse. Those are the magic words. As long as you say fraud, waste, and abuse, we let politicians do anything. As long as you say illegal aliens, illegal immigrants, we let politicians do anything without questioning them. It's crazy. Yeah. So we are trained very, very well, a lot of us, but our community here, yeah, we got the politicians' number. We know when they're BSing. And the reason we're getting cuts is because those same politicians said that same thing for 40 years. Oh, yeah, we'll kick the can down the road, and it's these people's fault, it's that people's fault. It's, whose people's fault? It's these people's fault, and it's us for letting them distract us and essentially tell us stories just to shut us up for the last 40 years. And so we need to do something about it. So will it go bankrupt? No. Social Security, as long as we don't give it to Wall Street, it'll exist exactly like it is right now. The problem is we're all going to get a 23% cut in a few years because the trust fund is running out. That's it. We just didn't plan. We've been told for decades the savings is running out. The cupboard is going to be bare. And we've been told that for 40 years. And we say, okay, well, we got 40 years, so we got plenty of time. We got 39 years. We got 37 years. We got 36 years. Now we've got 87 more checks. And are we doing anything? Yeah, not so much. Okay, so those are the 5 myths. And And so I just went over those really, really quickly because there's always questions and questions and questions. So let's get into some of those questions right now. Naomi, finally got my information from my Advantage plan. Not a ton of changes except for a big jump in cost. Wow, that I would say that's a bunch of changes. Now I'm waiting to hear from Stan at Chapter. Oh, okay, perfect. So you already got it scheduled with Stan from Chapter to go over your plan. So you have done what a lot of health insurance CEOs and the board of directors of these big health insurance companies, Naomi, they don't want you to do what you did, is check your plan. They just want you to trust them that they're taking care of you. And then, so if you hadn't done anything, something happened next year, you would have went in there and you say, wait a second, how come it cost so much? It didn't cost that much last year because you didn't check your plan. So you did the smart thing. You torqued off a lot of health insurance executives. So good on you. So now check to make sure, hopefully there's one that's better in your area and they'll get you switched over, and that new plan will start January 1st. So, hello, concern for Medicare Advantage plans is mounting. Yes, that is a fact. And remember, those people that had a PPO or a Medicare Advantage plan, that you're losing your plan, that means that company is completely canceling that plan. We talked about this yesterday with Ari from Chapter. You have guaranteed issue rights to get a Medicare supplement plan. So check it out. If you can't afford it or whatever the case may be, if it's not for you, then it's not for you, but at least you check it out. Rose, I and my husband are both on SSI, both in late 80s, home in disclosure, given a week to leave. For foreclosure. I'm seriously ill. Is there any help out there? Wow. Yeah, if you're on SSI, Supplemental Security Income, the welfare-based program, you should be on. If you're on SSI, do you mean just regular Social Security? SSI is a completely separate program. But I would probably on my website, I go into living on Social Security alone, and it goes through all the different programs that might be able to help you out. Federal programs, healthcare programs, food and nutrition, housing and utility assistance. A lot of these programs are being cut significantly because of the big, beautiful bill. We need to take care of our billionaires out there and give them as much tax breaks as we possibly can. That's the priority here in America today. So for the rest of us, good luck. But Rose, my recommendation is, if you have a law school in your city, in your state, I would reach out to them for the legal clinic and see if they can give you any help legally, or you contact the American Bar Association, chapter in your particular state, and see if there's anybody a lawyer that will do some pro bono work and help you out through that. Given a week to leave. That's unfortunately, if anybody else out there, that's the great thing about this community. We've got people all over the country who might have been in this particular situation. So let's help out Rose and let's see what we can do. If anybody has any recommendations, please. Rick, I wish I had the money, I'd give it to you. Wow. See, we've got the best people out there. Thank you, Rip. I keep you in my prayers. Yeah. Wow. That's for you and your husband, praying there's a way y'all keep your home. Yeah. So I would call, reach out to some type of lawyer, preferably a free one, pro bono, or the local clinic, legal clinic. On my new website, we're going to be listing all those legal clinics in each state, in each area, to help people out. So we are preparing for what's coming. So we're all in this together. John, Abby Normal, thank you. I'm hosed. Money isn't enough. I got to go back to some kind of work. That's unfortunate. Let's see other kind of questions. I've also got some video questions. I'll get into the video questions if people asked. I'm going to be taking off. I'll be back tomorrow. And then I'm going to take about, my wife said I have to take off. I have to unplug for a few days, so I'll be off for 3 days. So if you have any other questions, make sure you go into my website there, and let me put it on here. On the bottom left, if you can see, okay, the the bottom left, oh, you can't see it now. I'm all over the place. On the bottom left of my website, it has a little camera. You can click on that and you can record a video question and ask me. I've got about 5 or 6 of those today. So while I'm off for those 3 days, then record your question. And then when I come back, I'll make it a separate video and I'll answer everybody's question. So I'll do that I think Monday or something. I forget which day. My wife controls my my schedule. So my mom passed in June of 2023. As an only child, am I able to file for her Social Security payments? She qualified required to be in a pension teacher as per the Biden affair. If you are under the age of 18, or you became disabled before the age of 22, that's basically the only time you can file for benefits. If you're under 18, your benefits will continue until you hit until you graduate high school, or 19 and 2 months. But an adult child that's not disabled, unfortunately, no. So that's our Social Security. If your mother worked for the state as a teacher, I would definitely reach out to them and find out what's going on with that particular pension. See if there's anything in there as part of the estate. Hopefully we can all tread water through all of this. Yeah. And the difficult thing is getting people together and helping each other. There's nothing really out there for, the regular people to kind of get together and help each other. So that's what we're doing right now. So 380 people viewing. If everyone can afford $25, we can save Rose for a while until getting. Wow, Rick. Yeah, Rose. If you want to do that, more power to you. If you want to figure something out and set up a GoFundMe campaign or something like that, more power to you. Just go ahead and put it on the comments there. If I see them, I'll send them out again. But absolutely, yes, absolutely. Let's see. Bonnie, chapter called me back today. Once I can sign up. Jason helped me, so I have another appointment to sign up. My plan is not as much as last year, but not bad. Oh, okay. But it sounds like you found something better. So yeah, they can review all your plans starting October 1st and up until October 14th. They can at least see whether you're good or not. But they can't actually sign you up and switch your plans until October 15th. Another thing, all those people that are getting their plans canceled, they can at least tell you what the alternative is in terms of a Medicare supplement plan. A lot of people, don't know what that is, how much it is in your particular area, and all the rest of it. So they can definitely help you out on that one. Is the 20 or more employees local or national? Asking for my brother. I don't think they have 20 employees locally, but the place he works is national. Yeah, it's 20 employees in that group health plan. And to just sometimes you've got different divisions, and they write, it's a national company, but they're each independent in the particular state and stuff. So sometimes it gets a little wonky. So the best thing to do is to call your HR and say, hey, or your health insurance company that he has, and says, hey, is this creditable coverage? Does people that have companies that, like sometimes they have 19 employees and sometimes they have 21 employees. So there's, it goes up and down. So you just call the health insurance company and they'll tell you whether that's creditable coverage or not. So let's see, Jim, why can't we all receive retirement payments beginning of the month when bills are due, now that all the electronic payments instead mailed staggered to avoid mail theft and manage processing? Because the processing part is still there. Yeah. If everybody got the check on the same time and then there was an issue, then everybody would call Social Security at the same day. And then, so that's why they stagger it. Yeah. They used to, there was multiple reasons why they staggered it. And, second Wednesday of the month, third Wednesday of the month, fourth Wednesday of the month. And one of them was mail and stuff like that. But the other one is when issues happen, they want to stagger it a little bit. Yeah. There's some countries out there that send you your Social Security check every 2 months. So I don't know if we want to switch to that one, but was there a time stated for Social Security to run out before Doge came in? Yeah, it was pretty much the same. The the last big change was the Social Security Fairness Act that Biden signed, which wasn't fair. So I always try to be, politically neutral. I don't like anybody that messes up Social Security or Medicare. I don't care what political party the person is. So Biden signed the Social Security Fairness Act, which wasn't fair for the other 97%. And that decreased the Social Security Trust Fund by about 6 to 8 months or so. If the current President Trump, would have passed the no taxes on Social Security, which he continuously says he did, but he didn't, then that would have decreased that as well, and that would have cut another 6 or 7 months off of Social Security, the trust fund, because that money that you pay into as taxes goes into the trust fund. So here's 2024. You've got 1.1 trillion came in through FICA taxes, payroll taxes. You got 63 billion that came in through interest because that trust fund is getting interest. We're making interest on it, and 54 billion comes in for people that actually pay taxes on Social Security. About the upper half of people pay taxes on Social Security. So if that would have ended, that would have been $54 billion cut out of the program, and that would have cut about 6 or 7 or 8 months off of that. So our future checks wouldn't be cut in 87 months, it would have been cut in 81 months. And because of tariffs and all the rest of them, that affects your Social Security because it affects COLA, but we don't know what COLA is going to be until usually last year. COLA came out on October 10th. It usually comes out in the first week or so of October. Last year they were announced October 10th. But because the Bureau of Labor Statistics person was fired, we don't know what's going to happen here. So might be a little bit of longer delay. So nice to be here, but I will need to watch first half. I was on the phone with cyber problems. Okay, all right. Someone was saying before we started, they listen while they're working out. So that's always a beautiful thing. So probably not too good to put an address on here. No, I definitely wouldn't put an address on here. I would, Rose, if you want to do something like that, then probably the best, I'm not an expert on this, but if somebody could help her out, I think the GoFundMe type thing is a good option. Put your story down there and just come in here once you get it all set up, and then put in a link. I've got no problem y'all doing that whatsoever. Yeah, we're all in this together. So, Helene, I work for, so if anybody's ever done that GoFundMe, whatever, before, please let Rose, or if that's a good GoFundMe, that's the only one I know of. So if there's something like that, please let her know if you've got experience. I worked for years, but small jobs. So when my husband passed, I draw his Social Security. I am now 72 and was told I should have called when I was 70. Have I missed my drawing retirement? Absolutely not. So what happened is you collected survivor benefits when he passed, and that means you didn't touch your benefits on your own record. So your benefits continued to increase, and they will continue to increase up until 70 based on delaying. At 70, there is no more delay after 70. If you should have called at 70, then they're saying, you're 70, you lost 2 years of benefits, but they can give you 6 months of retroactivity. So they can at least 6 months. And then I would always ask for more and say, hey, I didn't know about it. And, I called you all like a year ago, and why didn't you tell me at that time? And try as best as you can to get as much back pay as possible. But at the very, very, very least, they can give you 6 months of back pay. So call immediately, if not sooner. Call immediately, because you don't want to lose any more money. And so what you're basically doing is switching from your benefits, from survivor benefits to benefits on your own record. So, Sarah, run to the phone. My boyfriend only has Medicare A and B. 2 weeks ago, he had an accident and had to go to the emergency. Now, is it possible to still add a supplement plan, or is it too late? I would do it. If you only have A and B, then unfortunately, that's going to be tough because remember, original Medicare Part A and Part B, pretty awesome. They're not perfect. But the big thing is Part B is a 20% copay. And so the hospitals, there's deductibles and stuff that you have to pay, and then Part B, and you're like, oh, okay, well, that's great. Most of my stuff was done, most of the stuff was it was done in the hospital, so don't have to pay that 20%. But remember, that's not how it works. If you go into the hospital and you stay, overnight, 3 nights, whatever the case may be, that is covered under the hospital. But then a doctor comes in and does stuff, surgery or whatever the case may be. That's the doctor type stuff is covered by Part B. So yes, you're in a hospital. Let's have you have knee surgery. You're in the hospital and you think that, oh, I'm in the hospital, so the 20% doesn't count. No, the hospital charges, the overnight and all that kind of stuff in the hospital, that's covered under Part A. But the doctor actually doing the knee surgery, that's covered under Part B, and you have that 20% co-insurance they have to pay, and then the deductible and all the rest of it. So I would definitely, because if he's had some type of accident, I'd reach out to Chapter immediately and get signed up for whatever, and hope for the best. Probably they're, health insurance companies, they're in it for a buck. So if they can avoid paying, stuff that has already happened, they will do it. But if he has an issue, then obviously he's going to have other things going in the future. So get started, get something immediately. So who watches over the people that work at the Social Security, and is it possible for them to steal? Yeah, absolutely. I've fired several people for not doing the proper things, and it's usually, people accessing records. One of the people I fired was alimony or child support. I think it was alimony, and wanted to see what her ex-husband was receiving to see if she can get some more alimony out of that person. And so she looked at the Social Security record, and Social Security tracks every time you touch the keyboard at Social Security. So it immediately comes up as a red flag. And so gave her the big chicken dinner, bad conduct discharge, as we used to say in the Marine Corps. Yep. But during the government shutdown, guess what? The Inspector Generals, all the stuff like that, yeah, they don't do. So yeah, it's crazy. Social Security suggested, and what's even worse is the Doge people in there. I don't think they get reviewed because they're above the law, kind of. That one Doge person that put everybody's information on an unsecured cloud, yeah, he's still there. So for regular Social Security employees, if a regular Social Security employee had done that, yeah, they would have been out. But Doge is above the law, I guess. So Social Security suggested that I divide all household expenses in half. Utilities, food, and half would come out of their Social Security. The other half from my husband and my dollars. Obviously, I use their money for clothing. Okay, so yeah, the only time they would do something like that is if you receive an SSI, Supplemental Security Income, the welfare-based program. Yeah, any other money you're receiving from, Social Security retirement or Social Security disability insurance, regular or spouse benefits, no relation to anything whatsoever. But yeah, if it's SSI type stuff, yeah, then if you got 2 people in a household, then yeah, that's how it works out. Well, there's an exception. If you have a stepchild, there's a half support requirement for that, but I don't think that's what you're talking about. So, Rose, I wrote your address down and I'll be sending you something wow. So, you guys are just awesome. Let's see. They told me my birthday, April 1, I don't qualify because of pre-existing condition. Oh, they told me birthday, April, I don't qualify because of pre-existing condition. Don't qualify. There is no, well, the only pre-existing condition that a health insurance company can deny you nowadays is a Medicare supplement plan. The Affordable Care Act, the Marketplace, Obamacare, whatever you want to call it, that ended the whole pre-existing condition. Remember before the Affordable Care Act, we used to hear in the news all the time, a little 12-year-old girl that has to go in and get surgery and stuff like that. And she had it's the stupid name, pre-existing condition. It's called your medical history. Um, you know, they used to be denied health insurance all the time because they were sick, and so they needed to get health insurance, and health insurance companies could deny that. Yeah, that ended with the Affordable Care Act. So that's a beautiful thing. Um, and Medicare Advantage, they can't deny you. They can't deny you for a pre-existing condition. Medicare Part A, Part B, they can't deny you for a pre-existing condition. For a Medicare supplement plan, a Plan N or a G, they can't deny you if you're in one of your if you're in your initial enrollment period. So you just turned 65, you're around that time. If you've lost health insurance from work, if you're in that special enrollment period, they can't deny you. But anything else outside of those particular areas, yeah, they can deny you for a Medicare supplement. Some states they can't, but it sounds like you are in a state that they can deny you, and that is a state issue. Yeah, so we need to, why does pre-existing conditions not exist in any other health insurance, but it still does in some states for Medicare supplement? It makes no sense whatsoever. So it's because we have just an unbelievably crazy system, and it's getting far, far worse. Millions of more people are going to be cut off of health insurance, the Affordable Care Act, because their premiums are going up significantly. Medicaid is being cut by $1 trillion, and that's what the government shutdown is all about. It's illegal to give health insurance to people that are not in this country legally, period, end of story. If there's an emergency, just, the alternative is, okay, so if you're in a terrible car accident and you go to an emergency room, or you have a heart attack, you go to emergency room, do we want the doctors to say, oh, okay, yeah, you're bleeding out, but I don't think you're an American. You look kind of Canadian-ish or whatever. Let's see your papers. Before I stop the bleeding, I want to make sure you're, in this country legally. And so, yeah, is that what we will want? No. So the money doesn't go to undocumented immigrants. It goes to the hospitals, because the hospitals take that hit. It's uncompensated care, as they call it. So if someone goes into anybody, even American citizen, most of the times American citizens, they go into a hospital and they get fixed, and they don't have health insurance. And so the hospitals get stuck with that. The doctors get stuck with that, and they just raise the prices. But if the government can go in there and compensate the hospital for those lost lost income based on Medicaid. So yeah, that's what it's all about. So. I feel so bad for seniors who are helpless and without assistance. I agree. And that's what that's what we're working on right now, is to help as much as we possibly can. Bonnie, you're such a wonderful person. Yes. And Mama, I know you are as well. We've got so many awesome people in this, in our thing. So, I called chapter. They said, stay where I am. Not any real different choices in my area. Perfect. Yep. That happens quite a lot. So at least you check. So you did the right thing. So you got peace of mind that you're in the best plan. So you don't have to do anything. Your current plan that chapter checked out for you and said it's the best plan in your area, it'll just automatically re-enroll. So you don't do anything, and next year you've got essentially the same plan you have this year. So, I'm sure they changed around a little bit of details under the hood, but it sounds like it's still the best one in your particular area. So, yep, you did the right thing. Perfect. Yeah, that chapter does that a lot. And it's like, oh yeah, yep, you're still the same. You're in the best one. You're good. We'll talk to you next year. So, Rose, take a deep breath. The cavalry is on the way. I need where to send a check. Oh wow, awesome. Let's see. Too late. They already put the the lady at Charter did not know what COLA. Yeah, nobody knows what you mean chapter. Yeah, nobody knows what the COLA is going to be for next year. So they won't announce that for a little bit. So normally within the next week, but yeah, it's all we don't know now. I have friends and family in Canada and the UK who are in awe at how much we as a people are spiraling. Yeah, but we've been in worse situations in this country, and we've always, yeah, Winston Churchill, you know, Americans always do the right thing after they've exhausted all other possibilities. All right, everybody's helping out. Let's see here. Turn 65, 12/7/25. I applied for Social Security retirement benefits to begin 1/26. Won't actually retire until 5/26 for 4 months. What happens to that withheld dollars? Will I eventually be refunded? Okay, so you turn 65 and you're going to continue working, retire. So you're making over the full. So you're going to begin January, but the first 4 or 5 months of benefits are going to be withheld because you're making over 23,400. Does that sound correct? What you're saying there? If that is the fact, then what happens is, yeah, your benefits start in May. So, okay, so because the first 4 months are being withheld, so that means they're withholding that check completely, and they're going to release the check in April or May. So what happens is once you reach your full retirement age, they take that into consideration. So let's say next year you work and they withhold the first 4 or 5 months. So they add those together. So let's say they withhold 5 months this year and then 5 months next year for a total of 10 months. So let's say you're taking your benefits 2 years early. So your benefits are reduced by 24 months because you're taking it 2 years early. Once you reach your full retirement age, the computer system automatically goes in there. It's called ARF, adjusted reduction factor. And the computer system automatically goes in there and says, hey, Jay is reduced by 24 months. But he didn't get 10 months of benefits because we withheld those 10 months. So what they do is they add those 10 months in there, and then going forward, you don't get reduced by 24 months, you get reduced by 14 months. So that's automatic. And yeah, so they'll do that once you hit your full retirement age, 100% automatic. So, all right, let's get into some video questions. I've got quite a few here because we spent some time talking to Ari yesterday, and I wasn't able to get to the video questions. So let's see what we got.
Hi, Dr. Ed. I'm having a problem. I have a judge's order. It's been almost 2 years since my ALJ hearing, and I got a favorable decision. The judge signed my order November 1st, 2023, sent it to the Maryland Home Office for them to process and calculate my refund. Unfortunately, the Maryland Home Office kicked it back to my local New Haven, Connecticut office, which the workers in the New Haven office are totally useless. This has been going on since 2021. They owe me almost
Wow.
$35,000. I have all my 1099 tax forms from 21, 22, 23, showing that they kept all of what they thought they overpaid me and then some, and they're still taking out the minimum $20 a month.
Okay, all right. So, wow, that is completely unsatisfactory. If the administrative law judge said, hey, pay this lady X amount of money, and they've been waiting that long, something definitely has fallen through the cracks. One of the problems is Elon Musk and Doge, recently, 8 months ago, got rid of a lot of the processing centers, the people that would normally work on that. But that your problem started before that, which there were problems even before that. It's been, Social Security has had problems for a while, as that's exactly what politicians want to be happening, is bad customer service. So in your particular case, I would normally tell you to reach out to your politician, and on your politician's website, and all politicians' website, the one that goes to Washington, D.C., you write, there's a little button that says, I need help with a federal agency, or you call them up. So call up one of your 2 senators, your House representatives, and you say, hey, here's the issue. And they will do what's called a congressional. But unfortunately, during a shutdown, it's even more difficult because they don't, I just read all of the workloads that they work during a shutdown, which has changed quite a bit from previous shutdowns. And it doesn't look like they work that. But I would get the process started. Reach out to your congressional representative and say, here's the situation, and they will expedite it. Yeah, even if it is shut down, I would definitely push it. Okay. So yeah, so I mentioned SSI.
Hi, I'm from San Antonio, Texas. And well, his daughter asked me if I'm already getting survivor's benefits. I have not applied for benefits. I'm 71 years old. I've been a widow like forever. I was common law married to him like forever too. So I just want to know, am I entitled for this? Yes or no?
Okay. Yeah. Common law marriage, some states do accept common law marriages. Some states currently don't, but they did before. So the best way to do it is just call Social Security. Social Security has to abide by local state law when it comes to marriage and divorce. So wherever you were married to him, if it's Texas, wherever, maybe you moved around. So I would call Social Security, and Social Security will look. You just tell them, I was a common law for 10 years, and we lived in this particular state, and they will look in the POMS and the policy manual that they have. It lists all of the states and all of the times and what's the documentation that you need to prove common law. So you had to be what's called kind of holding out as a husband and wife, on the same lease and stuff like that. So, but don't worry about it. Call Social Security, set up an appointment to file for surviving spouse benefits or whatever, and they will figure out exactly what you need. So get that process started.
To my children, 7 years old, I was filing early retirement in 62. I don't know how can I do that to get my benefits, my children.
Easy, easy, easy. You just go ahead and file for benefits. And then as part of the retirement process, they will ask you, do you have any children under the age of 18 or became disabled before the age of 22? You can tell I've asked that question about 1 million times. And you say, yes, I do have a child under the age of 18 or that became disabled before the age of 22. And they said, okay, what's that person's name? What's the child's name? What's the date of birth? Do you have the Social Security number? And then they'll give benefits on your record, basically 50% of your full benefit amount. And then there's a family max in there. So if you have more than one child, the family max might kick in. There's a maximum amount that could be paid out on a record. And then they will also take an application. So if you're doing this, if it's one child, then you're going to have 3 applications. You're going to have an application for your retirement benefits. You're going to have an application for, it's called auxiliary child claim. And then you're also going to have an application to be the representative payee for that child. So you or the mother, whoever can be the representative payee, that's ultimately responsible to make sure those benefits go for that child's welfare. And the child will receive benefits up until the age of 18 or until they graduate high school or 19 and 2 months. And if you have a wife that is taking care of that child and the child is under 16, then there's what's called auxiliary child and care benefits that the mother, the other spouse, the other parent can receive benefits as well. But they're limited the amount of money they can make in work and stuff like that. So definitely ask about that. Says, yes, I have child under the age of 18. And what's this child and care thing? Am I eligible for that? Is the spouse eligible for that? Definitely check that one out as well.
He's married to for over 20 years, and both of them has passed away. Can I still draw off either spouse? Thank you. God bless you.
Short and sweet. I like it. Okay, yeah. If you're married to multiple people and you're married the required time frame, if it's a divorce type situation, you were married at least 10 years. If it was if that person passed away while you were married to them, at least 9 months. There's a couple of exceptions in there. There's everything Social Security. There's exceptions. But yeah, call Social Security. find out if for survivor benefits, you have to be at least 60 years old. For regular spouse benefits, 62 years old. But yeah, call Social Security and say, hey, here's the Social Security number on my previous spouses, or here's their names and date of birth, or how old they are, where they were born, as much as information you know. And the Social Security person can find those two records, and they will look at it and they will determine whether you're eligible for benefits on either one of those records. So they will always go for the higher benefit. So whichever one gets you the most money, that's what they'll get you for. That's what they'll sign you up for.
Hello, good morning. I'm watching you on the YouTube, and what you said is very interesting. I don't have a money to pay you for one-on-one. I'm not working, and I'm only getting from Social Security 281 and 266. They said when I just got my social last year, they said I owe them money. I don't know where I owe them, and they taking out money every month out of my Social Security benefit. Next thing again with my food stamp, they bring down my food to $24. And then now, when I called them, they said they were sorry they made a mistake, that I was getting so much and so much money. Over $300 depend from what I'm getting, and that's a lie. They said somebody put it on there.
Okay, sounds like all right. So for Social Security, if you've got an overpayment and you don't know what it's for, then that means Social Security didn't explain it to you well enough. So I would call them up or fill out the form. It's SSA 561. You can find it on my website or the Social Security website, ssa.gov. Either one is fine. So it's SSA 561, a request for reconsideration. And you're just saying, I don't understand this overpayment. I don't think I was overpaid at all, or that amount, or I don't understand what the heck you're talking about. And they will look at it and give you a better explanation. And at that time, and if it's incorrect, then at least you know what the deal is, and then you can fight it. But yeah, right now it sounds like you're kind of in the dark and you don't know what it's all about. So that means they did a terrible job explaining it to you. You just tell them, hey, I don't know if I was overpaid or not, but because you haven't explained it to me. So explain it to me, and make sure they explain it to you in a way that you can understand. Sometimes, I'm guilty of it as too. I use, acronyms, PIA and SGA and stuff like that. So make sure they explain it to you. And if you disagree with it, remember, let me show you on my website that all the forms and everything. So where it says on the top, it says more, and then overpayments. And then, so here's the 561 right there, the request for reconsideration. And you can request a waiver, waive it. Yeah, if you're receiving food stamps and you're only receiving that amount of money and you have an overpayment, you can waive it. Two things have to be met in order to get a overpayment waived. It wasn't your fault, and that's a lot there. In terms of, okay, whose fault? And so, but it wasn't your fault, and you don't have the ability to repay it. So those two things have to be met in order to get that overpayment waived. So if you believe it's not your fault and you don't have the ability to repay it, if you're on food stamps, then you probably don't know how to have the ability to repay it. So if that's the case, they should waive it. And if they don't, then you appeal it again and you talk to another person. It's called a personal conference. So you talk to another person and you take another shot at it again. And supposedly when they're supposed to, while you're appealing that, they're not supposed to be withholding benefits while you're in the appeal process. So make sure you tell them, hey, I want to appeal this. I think it's completely wrong. And until I get my day to discuss this, stop withholding benefits. So, and they should take care of you there. So if they don't, make sure you come back here and we'll come up with plan B.
Hello, Dr.
Driving in.
My name is Rick, and I have a question for you. I owe overpayment. It's substantial, and I wondered if it's possible for me to negotiate if I pay them in cash. I don't know if it is or not, and I would like to know.
All right. So got an overpayment and wants to negotiate. No. It's I've never heard of that. You can debate the the calculation of the overpayment, and you say, no, this particular month, that particular month shouldn't be counted. I didn't, whatever. And so y'all made the wrong calculations. But if the calculations are right and you say, okay, well, I'll pay 50% on the dollar. Yeah, the IRS, I think you can do that, but Social Security and not so much. But remember, you can set up a payment plan. Definitely, you can do a payment plan. And so I guess and it's zero interest. So I guess you're negotiating there in the sense of, okay, well, I'll pay, the whole thing now, or I'll pay it over 60 months, a little bit every month with no interest. So I guess if you figure in the interest and all that kind of stuff, you're actually negotiating it down a little bit because you're not having to pay now. And so anyway, but yeah, in terms of right out negotiating a lower benefit amount, they really can't do that. You can debate the calculation and then negotiate there, but once the number is set, then it's pretty much set. So, but hey, it doesn't hurt to try.
Hi, Dr. Ed. Got a question for you. First, I'm born November 1955 and not eligible for Social Security because I was a government worker, municipal government. Wife, August 1st, 1960. She is eligible for Social Security. Here's the question. We're thinking of holding off until she's 70 to take Social Security because she'd get more money. Do I get 50% of her PIA at age 67 or 50% of her benefit at 70 so we know how to decide when and where to take her benefits? Her PIA is like $1,127 a month.
Okay, so both, but it depends on your particular situation. So you're still out there alive and kicking. So if you file for benefits and you are your full retirement age at that time, then you will get 50% of her PIA, her primary insurance amount, at her full retirement age, not the PIA plus the delayed retirement credits, those 8% every year that she will earn because she's waiting to file for benefits after her full retirement age. So if she waits till 70, she'll get her PIA. So let's say it's $1,000 plus 24%. So she'll get $1,000 plus $240 for a total of $1,240. You will only get $500 because it's based on her PIA, her primary insurance amount at her full retirement age, which is $1,000. If something should happen to her as a surviving spouse, then that's when those delayed retirement credits come in. A surviving spouse gets those delayed retirement credits, but a living spouse does not. So yes to both, depending on that situation. So, all right, we are over an hour, and unfortunately, I missed a whole bunch of questions. As always, I will be back again tomorrow, and we'll get into more questions. I'll talk about the shutdown and a little bit of different things, and how if you need help with Medicare, retirement, or anything like that during the shutdown, I've got a bunch of tips, tricks, and secrets. Most of my regular viewers already know about it. I talked about it a little bit yesterday, but I get new viewers every single day. And so I apologize for the repetition of my regular viewers, but we've got new people that come in every day. We want to make sure they get the information too. All right, you guys are awesome as always, and thank you for looking out for each other. Please continue to look out for each other. You guys are too awesome. We'll see y'all tomorrow. Bye-bye.